Today I call here with me Paul Sanders, Senior Director in Product Management, Oracle Insurance. Hi.
Thank you.
Good to see you. I'll leave you the floor. Just a second that we'll reestablish the presentation.
Okay, so I have 10 minutes and 10 slides. Let's try to hit that. First, my introductions. I work at Oracle. We do health insurance. So health insurance is different from P&C. Health insurance is different from life insurance. Why is it different? Because in life insurance, there's one claim. That's when some money passes away. In car insurance, P&C insurance, you might see one claim per 5 years. In health insurance, one person generates, on average, a claim per month. So the volume is much larger. There's much more emphasis on operational efficiency to start. Okay? So the presentation is how you can shift left. And let me start there. Yep. Okay. My background, I'm a computer science graduate. I live in the Netherlands, but I spent a lot of time in the US working with payers in the US. Currently, I'm in product management. I work with clients in 6 out of 7 continents. So my day starts with Australia, and my day ends with talking to clients in the Americas, in North and South America. So the joke we sometimes make is that we're still looking for a client on the South Pole in Antarctica, because then we have 7 out of 7 continents covered. Let me start introducing the concept to you. Okay? So traditionally, payers worry about 5 or 10% of the cost. So all presentations today were about 5 to 10% of the cost. It's how do you make your operations more efficient? Yep, you can do that with AI, you can do that with better systems. Sort of my main message is, yes, you should do that, but you should also think about how can you reduce, in terms of health insurance, how can you reduce your medical cost? How can you influence your medical cost? So instead of being a health payer, how can you become a health player? How can you influence the medical cost, the claims burden, or how can you move to other ways of paying for medical cost? Okay? So the main thing is you can strive to have higher quality care. Higher quality care means that you'll have more value for the money that you actually spend. So that's the first strategy. You can have more appropriate care, meaning that patients are not treated with procedures that are too expensive for the disease that they're actually suffering from. And last, and it's hard to see because of the chairs, you can try to become a partner in health. Okay? Just summarizing, do the things right means higher quality care. Do the right things, that's appropriate care, and avoiding the need to treat or transferring part of the risk to your partners in care, that's the partner in health. Okay, so now the question is how? Okay, whenever I have a discussion with my wife comes up with a good idea, and I ask her, well, that's a good idea, but how? Okay, so these are your strategies to influence your landscape, to influence your medical cost. And let me go through a few of them, because we only have 10 minutes. Co-payments is an instrument, and co-payments is the terminology for member liability. So it goes under many different names. It could be co-payment, it could be co-insurance, it could be deductible. It's called access in the UK and in Australia. It's that the members pay a part of their medical cost. So you're not repaying 100%, but you have members pay a part of the cost. Okay, that's a very good instrument for trying to push your members to higher quality care providers. Selective contracting means that you recognize which of your hospitals, which of your providers provide better quality, and you have contracts with your high quality hospitals, with your high quality providers, and you try to steer your members towards those high quality providers. Gatekeeping means people cannot just claim. They can't send in a claim and you'll pay it, but you actually try to open the door only when it's appropriate care. That's gatekeeping. Referral support, whenever someone is looking for a treatment, you help them by helping them find the right provider. That's referral support. Quality, price transparency. If you want to direct your members, if you want to direct your insured population towards the right providers, you also need to give them insight in how much it's going to cost, how much it's going to cost for them in terms of member liability. Okay? Value-based payments. Value-based payments is where you transfer part of the risk from your insurance company to the hospital, to the providers that you're working with. And you can do that in the forms of bundle payments. That's where you transfer part of the risk, or you can do that in the form of capitation. Capitation meaning you pay a fixed amount per person per month to the hospital. And for that amount, for that money, they need to take good care of your members. Okay, so that's sort of the strategies that you have. Now, let's go one level further. What is it that we do in my unit to help you with that? Okay, so Oracle is a big company. Oracle has lots of technology. That's at the bottom, cloud infrastructure. Oracle has lots of sort of SaaS services. You can have databases. You can have machine learning. We have all the AI tools. On top of that, we've built a number of applications. And let me not fall off. I'm into the payer applications. So my daily activity is talking to payers, talking to health insurance companies, understanding their processes, understanding their challenges, and designing software applications that help them to solve that. Okay. Next to that, we have provider applications. That's EHR, electronic health records. And we have enterprise applications. Think of accounts receivable, think of accounts payable, think of general ledger, those types of applications. And typically what we deal with is a combination or integrations between provider applications, payer applications, and the enterprise applications. Okay. So given this general landscape, let me move to where we solve problems. Okay. So we have a number of solutions that you can utilize to offer, to provide differentiated co-payments. So meaning that if a member visits one hospital, they'll have a different co-payment than when they visit another hospital. So the member is, well, not forced, but incented to go to one hospital versus another hospital. Because you know that that hospital A has better care, has better quality, has better value for money than hospital B. And that's why you differentiate in co-payments. At the bottom, number 2, quote claims. So quote claim is when someone says, okay, I'm about to be treated for this medical condition. Let's say it's a knee replacement, it could be a hip replacement, it could be some cardiac surgery. So we're talking about the costly operations. How much will that cost for me as a member? And nowadays, usually first you go, and then once you're back at home after a few weeks, then you see the bill from the insurance company saying, okay, well, the total surgery was 20,000, 30,000, 40,000 euros, and you have to pay 10%. Well, that's quite a shock, even if after you had heart surgery. So the solution we have is that you can send in a claim and say, what if I would have heart surgery at this hospital? How much would that be for me? And that's something we use for a number of our clients. Some countries that's sort of institutionalized. It's part of the process. In Australia, when you show up at a hospital, you can actually run what they call a quote claim as part of the process. They will tell you before you check into the hospital, okay, we estimate that these are your services. We estimate that you'll stay with this hospital for so many days. We'll run the quote claim, and that means that you will have to pay, as part of your member liability, as part of your co-payment, you will have to pay $2,000, $3,000. Could you please provide evidence that you're able to pay that? That's common business in a lot of countries that we deal with. Okay, selective contracting and claims pricing. That's where you make the difference. So instead of having one contract with all of your providers, instead of having one contract that applies the same amounts and the same rates and the same conditions to all of your hospitals, you can make a difference by saying, okay, this chain of hospitals, this preferred network, US terminology, will pay you 5% more because we know you deliver better quality. The other chain of hospitals, well, will pay you the normal rates. The third chain of hospitals will pay you 5% less than the standard rates. Okay, let me move to the next. Okay, so we have a number of solutions that play in this space. So I've been with Oracle for 30 years. So over 30 years, we've developed a set of solutions that provide services that do the things that help you with driving the strategy, driving the shift left. So we have a number of engines that we supply to our clients. We have a care management engine. And care management is if someone requests care, you actually manage where they go. They can't just go to a hospital, you manage it, you tell them, okay, these are your choices. You can go to hospital A, hospital B, but we advise you to go hospital A. We have a provider agreements engine where you can make the difference, where you can set up all the contracts with your providers, with your hospitals. We have a product benefits engine where you can make the difference and say, okay, well, your benefits are, for this chain of hospitals, they're 100%. For the next chain of hospitals, they're 95%. For the third chain of hospitals, we'll pay you 90% of the cost, and you need to pay 10%. We have a value-based care engine where you can register your population, and your population will be paid a certain amount per month. So that's capitation, literally per head, a fixed amount per head. And we have a claims engine that processes quote claims, that processes reservation claims, and that processes real claims. Okay? So those are sort of the ingredients, those are the tools that we provide as a company, as a unit. But sort of the last lesson, it actually starts with understanding where you're spending your money. And it starts with understanding the quality and the cost of your provider space. Who are the quality providers? Who are the providers that have lesser quality? And usually quality in healthcare is defined as the number of readmissions. So how many readmissions do you see? How many complications do you see? And how much mortality do you see after an operation? So if we talk, for instance, heart transplants, cardiac surgery, what's the mortality rate? That's something you can measure based on your claims. So what we would like to leave you with, food for thought, is how can you measure the quality of your providers? Which of the strategies in this presentation can you use to make a difference to shift left? And if you're interested, what are the tools that you could use from us to actually shift left? Thank you.
Thank you so much, Paul, for being with us today.